Hi, it's Dr. Tim Jones here from Glebe Family Practice. I'm here to talk about a common issue. Bedwetting is a very common issue that can affect many school-aged children and their families. Sometimes it can be responsible for major effects on confidence and self-esteem. Often it will resolve over time, but if treatment is required, there are several simple treatments that can make a big difference. The medical term for bedwetting is called enuresis. It's more common than you might think. At the age of 4, about a third of children will wet the bed, but by age 10 that's dropped to 1 in 20. Around 1 in 25 kids will still have episodes of bedwetting as a teenager, which means there's likely more than one in every class at school. It's a shame, but there's a stigma around bedwetting, and because we don't often talk about it, children can frequently feel embarrassed or that there must be something wrong with them. As parents, it's very important that we provide reassurance. As health professionals, we don't fully understand all of the causes that contribute to bedwetting. However, what we do know is that a family history is very common. If your parents or your siblings wet the bed, then it's common for you to do it as well. We also think children with smaller bladders or who sleep very deeply can be affected. One of the most common issues that can worsen bedwetting is constipation, so if there's any hard, painful poos, it's important that these are addressed as part of treatment. We're confident that bedwetting is not done for attention and that children who wet have little awareness or control over what's happening. You can consider seeing a doctor about bedwetting if your child is at least 6 years old. That's because treatment for bedwetting at earlier ages is far less effective. We also recommend considering treatment if the bedwetting is having negative impacts on the health of your child or the overall well-being of your family. If there's any daytime wetting or soiling with poo, it's really important that this get checked out, as it's often a sign of a different problem. And it's very important that if your child has been dry at night for at least 6 months and starts wetting the bed again, that this be evaluated by a doctor. One of the simple treatments you can try for bedwetting is a reward chart. A chart that your children decorate all by themselves with reward stickers for staying dry at night. However, it's important to note that this rarely works all by itself. It's a common misconception that restricting the child's intake of fluid in the evenings will help bedwetting. This has been studied and proven to not make a difference, and sometimes can even worsen the problem. The only exception to that rule is drinks containing caffeine, such as coffee, tea, soft drinks and hot chocolate. It's important that these are ceased in the evening. A successful first step to treating bedwetting is a bed alarm. More than 8 out of 10 children will become dry using this treatment and will remain dry at night. A few will require a repeat period of treatment in the future. The challenge with the alarms is that they require at least 1 month of treatment to work, and so a supportive and helpful family for the child during this time can make a huge difference. In Tasmania, the easiest way to obtain a bed alarm is by hiring one through the Wetaway program, as the cost of purchasing them is high. Wetaway or your doctor can provide detailed information as to how to use an alarm well to ensure the highest chance of success. There are medications available that can assist with bedwetting in some situations, such as school camps or sleepovers, or if a bed alarm hasn't been successful. Your doctor can provide more information regarding these. With careful encouragement and a lot of patience, your child can often beat bedwetting and return to enjoying dry nights. It's important as parents to be very involved and supportive of a treatment plan for bedwetting. I hope this has provided some useful information.